gives me the perfect opportunity to introduce our next speaker. Dr. Robert Ronis is the Douglas Danford Bond Professor and Chairman of the Psychiatry Department at University Hospitals Case Medical Center, Case Western Reserve University School of Medicine, and Psychiatrist-in-Chief for the University Hospitals Health System. In January 2010, he was elected as the Psychiatry Director for the American Board of Psychiatry and Neurology. He has served as President of the Cleveland Psychiatric Society and the Ohio Psychiatric Association, and Chairman of the NAMI Greater Cleveland Medical Advisory Board. He is the co-director of the Center for Evidence-Based Practices at Case Western Reserve University and co-founder of the Public Academic Liaison Program, providing more than 800,000 hours of clinical and education services in Cuyahoga County. Please welcome Dr. Robert Ronis.
Thank you, Jack. No rain. What happened? Pardon me, I'm going to have a little senior moment here. We're gathered tonight as friends and neighbors, as parents and children, as mental health providers and survivors, teachers and students, concerned citizens and friends. We're here to address an epidemic. We're here to offer hope, to send the message that no one need have his voice unheard, no one be left without options, no one end his life hopeless and alone. We will fail. But if we reach even one person, we've accomplished something. If we reach 100, we'll have cause for hope. And if we reach 1,000, we'll have reason to celebrate and then go back to work. Suicide costs the lives of nearly 40,000 Americans each year. It's the 10th leading cause of death in the United States, almost double the rate of homicides. For young people, suicide is the second leading cause of death. These are all numbers we've all heard, statistics that tell part of the story. But statistics don't carry the weight and the depth of the tragedy. The real tragedy is that suicide can be prevented. Depression is the strongest risk factor for suicide, and 80% of those who seek help for depression are successfully treated. Substance abuse is another major risk factor, and substance abuse too can be effectively and successfully treated. But many who attempt suicide never seek professional care, and too often those who may be willing to seek help don't know where to find it. We have particular challenges when dealing with young people who depend on families and teachers to see their pain and to act on their behalf, sometimes only to find that we're tragically under-resourced to provide these services. But the biggest tragedy is the lack of knowledge that keeps victims from even those resources that are available, and the stigma that these often very effective services carry in our society. For these and so many other reasons, I'm proud to join Jack and LifeAct in announcing a new partnership, joining ourselves in the Department of Psychiatry at UH and at Rainbow, with LifeAct, and with our community partners at Frontline Services. As Jack has said, LifeAct, with its in-school education and prevention programs, will help to inform and in some cases identify potential victims. Frontline Services, with its 24/7 crisis hotline and its mobile outreach services, will provide immediate assessment resources for our students and our schools. And UH will serve as the primary treatment resource for those who need professional, compassionate services. It's a simple approach. So simple that we're not aware of another such partnership across the country. And it's in its simplicity and our mutual dedication to preventing suicide, and if and whenever we can, that will make a difference together. Our message is simple: there is hope and there is help. We are honored to be part of this quest and to join with you as we walk together into the light.